안녕하세요. 사람을 먼저 생각하는 휴고 성형 TV의 양성혁 원장입니다.
In today's episode, we'll talk about this magical procedure where we can get our once beautiful face back to how it was 5 to 10 years ago. I'm going to tell you more about facelifts. The purpose of facelift is to lift the facial features that have been sagging due to old age. However, it's a shame that the skin's enlarged pores or speckled pigmentation etc. related to old age skin texture cannot be solved by facelifts. However, if you feel that your face is overall heavy or you feel your face structure sagging or at a sudden point in time, you feel your face looking a bit hollow or there are bulging fats, you can find out more about the facelifts. The facial skin has a muscle components above the bones that help to make facial expressions. And there is a fascia covering that muscle, and above that, there's fats and after that the skin, so we have the components that lay on top of each other part by part. Due to old age, when we lose elasticity of skin, the middle and lower part of the face area extensively become saggy and start to have wrinkles. At this point, the unique thing is that it's not saggy like how the overall area flows down, but there's especially one part that could be affected, and there you will have a large wrinkle or skin furrows. Very commonly we see it at the nasolabial fold or the lower part of the cheekbones and area below the lips. We might have wrinkles or furrows at those areas mentioned. Because in those places, if you see this as a bone, there's a strong part that holds the bone all the way to the surface of the skin called the retaining ligaments. What you can think of is there's a tree that's rooted in the bone. Think of it as a branch spreading out and holding onto the skin. Then the skin wouldn't be able to sag. In other words, the tissue that's drooping over the retaining ligaments gets stuck in this hard, tough ligament tissue and hangs on it. So the more it sags, the more it folds. So, the smile lines, the Indian lines, the marionette lines that we're talking about are so good at preventing this retaining ligament from sagging. But if you don't cut off the retaining ligament and instead just lift them, in the end, deep wrinkles can't be solved. So releasing the retaining ligament safely is the first key to facial lifts. But here I said something wrong. I said we pull the skin layer after cutting off the retaining ligament, but actually, if we just pull only the skin layer, it doesn't improve the saggy cheeks, and it's less effective for pulling. If the skin is pulled forcibly, it will result into bad scarring as well. So then what do? As I mentioned before, facial muscles on the bones, the facial layer that surrounds the muscle, we call them SMAS. We pull this structure because the facial layer itself is very thin, but it's much harder than the skin. So even if we pull this structure, we can pull it really hard. So pulling the SMAS facial layer is the second key to facelifts. Even just by pulling this hard SMAS layer, the layer of skin that's covered on top of it naturally lifts. Also, by pulling the fascia layer to lift it, the area that is sagged due to aging stretches out, so it's more effective. After that, the naturally elevated skin layer should be trimmed to have a high-quality facelift. Most of these procedures take approximately 2 to 2.5 hours. As the most common side effect after surgery includes hematoma and temporary lip paralysis. In order to prevent this hematoma, in my case, I will have drain tubes placed. And 1 or 2 days after surgery, if the blood from the drain tubes runs low, I'll remove it. And the second inconvenience that I mentioned is lip paralysis. Mostly due to the effects of topical anesthetics, and in this case, it'll return to normal the next day. But if it's been 3-5 days and a week since the surgery, there are times where there's only a little movement. In this case, it might be different depending on the surgery areas. But if you wait for 3 months to up to 6 months, you can rest assured that the movement will return sufficiently. Swelling and bruising after the surgery usually goes away a month after surgery. From then on, you'll be able to feel the unabated outline of your face 5 or 10 years ago. When I consult with patients about facelifts, there are 2 things that tend to be worrying them. Those who really want to do it but can't afford it, or those who really want to do it but are scared of the surgery. But I understand how they feel. How about solving those problems with me, who fully understands how you feel? I was Dr. Yong Seong Hyuk, a plastic surgeon.